Hello everyone and welcome to this channel. In this video, we will talk about adrenergic neurons and how neurotransmission at adrenergic neurons happen. So basically, adrenergic neurons are the neurons that release norepinephrine as their primary neurotransmitter. And most of these neurons are found in the central nervous system and also in the sympathetic nervous system. And these neurons are the site of action of the adrenergic agonists and antagonists. If we talk about the neurotransmissions at these neurons, it involves 5 steps, which are the synthesis, storage, release, and the receptor binding of norepinephrine, followed by the removal of this neurotransmitter from the synaptic gap. So norepinephrine is synthesized from an amino acid called tyrosine. Tyrosine is transported by a sodium-linked carrier into the exoplasm of the adrenergic neuron, where it will be hydroxylated by the enzyme tyrosine hydroxylase to dihydroxyphenylalanine, DOPA. And this DOPA is decarboxylated by the enzyme called DOPA decarboxylase to form dopamine in the cytoplasm of the presynaptic neuron. So dopamine will be transported to the synaptic vesicles by an amine transporter system that's also involved in the reuptake of the formed norepinephrine. So when dopamine is on the synaptic vesicles, it will be hydroxylated to form norepinephrine by the enzyme dopamine beta hydroxylase. And in the adrenal medulla, norepinephrine is also methylated to form epinephrine, which are released from the adrenal medulla. If an action potential arrives at the nerve junction, it will trigger the influx of calcium ions from the extracellular fluid to the cytoplasm of the neurons. This increase in the calcium will cause the vesicles inside the neuron to fuse with the cell membrane and expel their contents into the synapse. And this norepinephrine will bind to either postsynaptic receptor on the effector organs or to the presynaptic receptors on the nerve ends. Most of the adrenergic receptors are G protein coupled receptor, and they will be helping to transduce this signal to a biological effect. So after norepinephrine show their effect, it will be finally removed from this synapse, either by diffusing outside the synaptic space and entering the general circulation, or being metabolized by the enzyme catechol methyltransferase in the synaptic space, or recapturing by an uptake system that pumps the norepinephrine back to the neurons. If we continue with adrenergic receptors, we have two subfamilies, which are the alpha receptors and beta receptors. And these two types of receptors are identified on the basis of their response to the adrenergic agonists, which are epinephrine, norepinephrine, and isobutyrenol. And these adrenergic agonists, they show different affinity to these receptors. For example, epinephrine has high affinity for alpha receptors. That is why the rank order of potency in alpha receptors starts from epinephrine, and then norepinephrine comes. After that, isobutyrenol comes. Like isobutyrenol shows low affinity for alpha receptors. Alpha receptors are divided into alpha 1 and alpha 2 receptors. Alpha receptors are G protein coupled receptor, especially GQ coupled receptor, and they are found on the postsynaptic membrane of the effector organs. While alpha 2 are located primarily on the presynaptic nerve ending on other cells such as the beta cell of the pancreas. And these alpha 2 receptors, they are GE protein coupled receptor, like they will inhibit adenyl cyclase and they will cause a decrease in the level of intracellular cyclic AMP. While in beta receptors, the most one that has the highest affinity is isobutyrenol, and then epinephrine comes, and then norepinephrine. And these receptors are divided into major 3 subgroups, which are the beta 1 receptors, beta 2 receptors, and beta 3 receptors. Again, based on the affinity for the adrenergic agonists and antagonists. And these receptors, they are GS protein coupled receptors. These receptors are distributed differently on our human body. For example, tissues such as the vasculature and skeletal muscle, they have both alpha 1 and beta 2 receptor, but the beta 2 receptors predominate. While other tissues, they may have only one type of receptor exclusively, with practically no significant effect of the other receptors. For example, the heart contains predominantly beta 1 receptors. When alpha 1 receptors are stimulated, it mainly produces vasoconstriction, particularly in the skin and abdominal viscera. And this will cause increase in total peripheral resistance and blood pressure. While when beta 1 receptors are stimulated, it will cause cardiac stimulation, like increase in heart rate and the cardiac contractility and etc. And beta 2 receptor stimulation, it will produce vasodilation in skeletal vascular beds and smooth muscle relaxation. If you look at the mechanism of action of these adrenergic agonists, they are divided mainly into three groups, which are the direct acting agonists and the indirect acting agonists and the mixed action agonists. For the direct acting agonists, from their name, they act directly on the alpha 1 and on the alpha and beta receptors, and these include like epinephrine, norepinephrine, isobutanol, and phenylephrine. While in the indirect acting agonists, they can block the uptake of the norepinephrine, and for example, cocaine, or they are taken up into the presynaptic neuron, and they will cause the release of norepinephrine from the cytoplasmic pool or from the physical of the adrenergic neuron. And adrenergic agonists that acts like this is amphetamines. Finally, we have the mixed action agonists. These agonists, like for example, ephedrine or pseudoephedrine, they have the capacity to direct and affect the adrenergic receptors, and also to release norepinephrine from the adrenergic neurons. Thank you for watching this video. Please don't forget to subscribe to this channel.